Good morning, friends. Today, our topic of discussion is primary health centers. PHC is the short form which is being used for the primary health centers. So, the objective of primary health centers are the essential topic in community medicine from the point of view of your examination as well as in your day-to-day practice. Also, that is being one of the important interconnection which is being required to be understood. So, let's begin. First, the introduction. The primary health center occupies the main state of our nation's healthcare system. It gives an integrated curative and preventive methods of healthcare treatment, specially centered for the rural population or rural people, where the healthcare facilities are still being scarce and not fully available. And their main emphasis is on promotion of health as well as the prevention of the different diseases. So, to understand about this, we need to see that key PHCs are being structured based on some of the important basic things which is being given based on the number of population in the rural areas. So, how much people is being there under every PHC? So, rural population should be around 30,000. So if there is one village who is having around 5,000 and other village having around 8,000 and one more village having around 9,000. So like this, they are being combining two, three villages in such kind of situation and give a place, center place for the primary health centers. In hilly and tribal or backward areas, even if it is not being around 30,000, that is okay. No? So maximum up to 20,000, they are being giving, allotting a PHC for hilly, tribal or backward areas. So PHCs having this plan, CHCs is community health centers. They are a little bit higher to the PHC and SC is nothing but the sub centers which are being there where lesser number of population is being required. Sub centers are given for 5,000 uh, persons locality in a rural area and around 3,000 in a hilly and tribal areas. So these are the criteria for the setting up of a PHC. We'll try to understand what exactly the aspects of this PHC. So to start with, we need to understand the health given by WHO. So health is a complete state of physical, mental, and social well-being, not merely an absence of disease or infirmity. So it should be at all the three different dimensions and planes. Physical भी होना चाहिए, mental as well as social भी होना चाहिए. And to achieve that, these PHCs are playing a very important role. So our PHCs are being coming under primary health care. So one of the important things which is being declared in Alma Ata 1978, that is primary health care is an essential health care which should be made universally accessible to all individuals, as well as it should be acceptable to the people who are being treated, along with their own participation, and the cost should be such that it should be affordable to all. So that is what is primary health care, and it has been declared in 1978 in Almata. And under this primary health care, the centers which has been built for taking a primary care of all the kinds of problems is known as primary health centers. So PHC is an institution for providing a comprehensive type of healthcare, which can include all the varieties like curative treatment, the diseases for which the patient usually comes to the clinics. Then preventive care also comes under PHCs, as well as the promotive healthcare to the people who are being coming under the areas of PHC. So that is what is being basic definition of primary health center. As we have been talked about that key primary health care. So healthcare is basically divided into three levels of care. So first level is primary health care, which comprises of the health education, diagnostics, preventive aspect, therapeutic aspects, and the minor surgeries. So primary care is a basic approach for providing the health care for all the people of the country. One of the most important system to tackle with basic problems of any country. Then comes the secondary level, that is secondary healthcare system. It is usually being there for problems which has been a little bit higher than that of a primary level. The problems which are of a little bit more serious, they are being having, which is being of a short term in nature. Sporadic consultations is required on and off with a specialist. यहाँ पे स्पेशलिस्ट की जरूरत पड़ती है, तो जो प्रॉब्लम्स प्राइमरी लेवल पे सॉल्व नहीं किए जा सकते, which required specialized treatments or intervention, that comes under secondary care. So primary के upper level पे जो आता है, that is secondary health care. So that is second level. And about to that secondary के ऊपर जो आता है, जो most advanced diseases से critical illnesses से all such kind of care is being coming under tertiary level of healthcare. So the conditions which are being rare, serious forms, and which are being requiring very higher specializations, that is being coming under like transplant surgeries हो गए ना, bypass surgery हो गया, these kinds of things are being coming under the tertiary healthcare system. So these are the levels, and today we are being seeing about primary healthcare का जो main part है, that is PHCs, primary health centers. So first level of healthcare होता है, that is being known as primary healthcare. It is being the first level of contact between the patient and healthcare system. So ये first contact point है, and it is being essential for the primary care. One of the essential element it is being even being said to be a right of a person. So majority of the common illnesses, prevailing health problems जो होते हैं, that can be managed at a primary level, and it should be close to the people who are being living in that area. It should be provided in the PHCs. कहाँ पे मिलता है ये सर्विस, हेल्थ केयर, प्राइमरी हेल्थ केयर, that is given in the PHCs, sub centers and CHCs. Then comes the secondary health care. इट इज अ लिटिल बिट कॉम्प्लेक्स प्रॉब्लम्स जहाँ पे सॉल्व किए जाते हैं, उनको ट्रीटमेंट दिया जाता है. Comprises of curative services. It is usually being provided at district level hospitals. They are being known to be as a first referral level. PSC say they are being sent to the secondary healthcare centers, which are usually district or sub-district level hospitals. And then the last one, that is tertiary healthcare. It is being mainly for super specialty care. It is being given at a regional or central level by the higher institutions. They even provide an additional training for those who are being in their healthcare system. So specialized training are also being a part of tertiary healthcare, so that the future generation should be ready for all the types of healthcare. So that is the thing which is being coming. So we have been seen about three levels of healthcare: primary healthcare, first level of contact where prevailing diseases are tackled; secondary healthcare, where the more complex problems are dealt; and tertiary, the more advanced diseases, cancer, and all these kinds of higher disorders comes under the tertiary healthcare. Now we'll see what are the basic principles of PHCs. So PHC is being set up with a certain basic understandings and principles. It should be have an equal distribution. ये सबके लिए समान होना चाहिए. So equitable distribution should be there. So based on that, that criteria has been decided that it should be given to around 30,000 people who are being living. Whatever things which is being there, it should be all the people who are being there. Na? So चाहे वो किसी भी कास्ट का हो, किसी भी रिलीजन का हो, किसी भी तरह का हो, चाहे it might be rich, he might be poor, it should be available to all. So equitable होना चाहिए, सबके लिए समान होना चाहिए, मेल हो, फीमेल हो, everyone. So that is equitable होना चाहिए. Second, there should be a community participation होना चाहिए. It is not like that कि the PSCs are being working without participation of the community or villagers. So if they are being a part of that PSCs, then it would be more effective for preventive and promotive healthcare. And that's why community participation is one of the important principle of PSC. Then it should have an intersectoral collaborations. So we have been seeing that day by day with advancements, different types of systems and therapies are working together. Not only the modern medicine, but along with that, Ayurveda, homeopathy, and all these different intersectoral collaboration should be there, as well as other sectors, non-medical sectors should also collaborate for improvement of the infrastructure and other kind of facilities. So that all comes under that. And next is the appropriate technology should be used in the PHCs. So it should be up to date. They should have and up to date technology which need to be implemented in tackling with the primary problems of the people who are becoming at the PSC level. It should play an additional role of prevention of the diseases. So these are the five basic principles of PHCs, primary health care के ये पांच basic principles हैं. Equitable होना चाहिए distribution, community participation होना चाहिए, intersectoral collaboration, appropriate technology, and prevention. So these are the five principles of PHC, as we already talked about. Health services for all. Community involves the people should be involved in decisions based on the problems which is being occurring in their villages. So that is going to make a better collaboration of health services. Health promotion for prevention of illnesses. Simple and affordable solutions होने चाहिए. Intersectoral collaborations like water, education, nutrition, all the kinds of things should be there. Till now, what is the situations of the PHC in India? Total of 31,882 PHCs are there. Out of that, Maharashtra had 2,490 PHCs, 2,490. And in our district of Nasik, PHCs are 103. The basic requirements for PHCs are being graded. What should be the criteria for the PSCs? It is being divided as 8 A's and the seats, 3 seats. So it should be appropriate होना चाहिए, appropriate based on the locality and situations which is being available. कौन सा rural area है, कहाँ पे है, क्या क्या चीजें हैं. Based on that need, it should be appropriate to all the people who are being living in the community. It should have availability. The availability is being one of the important things. If they are being there present and if it is not available to them, then it is of no use. So that is one of the important thing. As well as adequate होना चाहिए. 30,000 people के हिसाब से जो भी हेल्थ केयर फैसिलिटीज की रिक्वायरमेंट होनी चाहिए, that should be adequately quantitatively, that should be met with according to that. Then accessibility होनी चाहिए. Accessibility is being one of the important thing. Easy to reach, easy to be available होनी चाहिए, as well as it should be acceptable to all the people who are being living in that area. And most important thing is affordability होनी चाहिए, having at low cost, accessibility, and accountability are being one of the important hallmarks of the PHCs. Complete होनी चाहिए. It should not have any kind of lacunas or incompleteness. Comprehensive, easy to understand and to work with, and continuity should be there. The some of the important aspects relating to the history and evolution of PSC in India. 1977, as we have been talked about, the 77 and 78 are being the one of the initial years when that all the things has been there. So placing the people's health in the people hand has been mentioned in the Rural Health Mission in 1977, and to achieve that, PSCs are being set up. So primary health centers in India, Board Committee in 1946 recommended for the basic health unit need to be provided, which should be giving curative as well as preventive both the types of services to the rural population. At that time, PSC for 10 to 20,000 population with 6 medical officers and 6 public health nurses is being the guideline given by a board committee. Then Central Council of Health in 1953 recommended establishment of PSC in the community blocks. They have given one PHC for 1 lakh population with little or no community involvement. Then Mudliar Committee in 1962 were focusing on strengthening of existing PHCs, and they recommended 40,000 population should be there for one PHC. Then Srivastava Committee in 75 focused on providing community health care should be provided by the health workers who are being from the same community. लोकल लोग रहेंगे तो it is being more easy and more better for people to get a better services. That was the point that is being there. And in the National Health Plan, one PSC has been finalized for 30,000 population in a rural area. Staffing pattern: medical officer, minimum one medical officer, one pharmacist, one nurse midwife, healthcare worker female, one block extension educator, one health assistant male, one UDC and LDC, one each, lab technician, one driver for the ambulance, class four people, with a 15 staff should be there in the one PSC. So, what are the different elements of that of PSC? Mnemonic, which is being made from the word element itself. E for education, then it should be locally endemic diseases के लिए उन्होंने काम करना चाहिए. They should work for. They should have an essential drugs available for all the diseases which is being prevailing in that community. Maternal child health care is one of the integral part of the PHCs. Expanded program of immunization schedule should be followed. Nutrition guidelines and corrections are being required. Basic treatments of all kinds of first line of disease management is being required in the community. Safe water sources need to be looked for. So these are the areas which is being there. They can also be labeled as a short note can be asked on the functions of the PHC. फर्स्ट इंपॉर्टेंट फंक्शन इज मेडिकल केयर. सबसे पहला काम है कि जो भी पेशेंट्स आ रहे हैं उनका राइट एंड अप्रोप्रिएट ट्रीटमेंट किया जाना, उनका सही डायग्नोसिस करना. देन कम्स द maternal and child health, including family planning services need to be provided. So mother care during pregnancy, after pregnancy, and child care is one of the most important for the development of nation, and that's why it need to be focused on. Then next is function is safe water supply and sanitation need to be looked into within that area of PHC. Prevention and control of diseases which is being prevailing or endemic in the PHC area. Collection and reporting of vital statistics, birth, deaths, all the kinds of different kinds of vital statistics need to be collected. Marriages, pregnancies, and all these kinds of things are being coming under that. Health education to the people who are being living in the areas of the PHC regarding different types of diseases which is being prevailed in that area. National health programs need to be implemented with the help of PHC. So PHC plays a very vital role in the primary health care, and these are all one of the most important functions. And the last but not the least, that is the referral services need to be implemented. Functions of the PHC: As we already talked about all these basic functions which is being there, referral services means those who are being requiring an additional facilities need to be provided for further treatment in case any case they need to be referred to the higher centers. That is referral services. As well as it includes training of health guides, health workers, लोकल दाइज होते हैं जो डिलीवरी का काम करते हैं. सो हेल्थ असिस्टेंट इन सबको ट्रेनिंग देने का भी काम फंक्शंस वहाँ पीएचसी में किया जाता है. बेसिक लेबोरेटरी सर्विसेज आर आल्सो बीइंग देयर. So that is the thing which is being one of the important aspects. So these are all the important things what we need to look into. That's all for today. We'll stop here today. That's all about the PHCs.